Hey, everybody. Welcome to another episode of Clinic Gym Radio. I'm your host, Dr. Josh Satterlee, and it's going to be a blockbuster of a day because we've got three great folks here with us. I've got Nick Baker, Nate Baker, and Keith Yoho. Fellas, how you all doing?
Doing great, man. Thanks for having us back.
Doing well.
Awesome. Yeah. If you want to, you can go back in the archives and find a previous interview I did with these guys. But between now and then, some fun stuff has happened. And you guys are doing it. You're living the dream. You're making the dream up as you go. You're flying the airplane there in Grants Pass, Oregon. So I would love to talk about some of the ups and some of the downs that you guys have experienced and seen. And maybe we can pull out some lessons for people to learn. How's that sound?
Sounds good. We definitely have a few of those.
Yeah. Well, just to get everybody on the map here of kind of what's going on. Number one, if anybody's listening and wants to see their clinic up close and personal, we are doing an SFMA course. They're hosting an SFMA course in June of 2022, right?
Yeah.
So we would love to have you out there. But give everybody an idea of kind of the overall your facility. How many square feet? Is it a clinic? Is it a gym? Is it both? And how many providers you got, et cetera, so we can kind of picture where we're going to go.
Okay. Our clinic is a combo with just about 50-50 clinic and gym. It's total 6,500 square feet and through about 3,500 square feet of that is the actual clinic, and then 3,000 is the gym. We have 3 chiros right now, and then we're adding a 4th in July, and we're actually adding physical therapy and a PT in June. And then we have like 6 massage therapists and 3 chiropractic assistants.
All right. And how about on the gym side?
2 trainers. 2.5.
All right. And
we have one guy that kind of does
over the next 3 months, you think you're going to stay at about 2.5 trainers?
Hopefully it's 3, and they're full time. They're none of them are part time.
Hardest part of that question isn't necessarily if we're going to be busy enough to employ another trainer. It's if we're going to be able to find another trainer that's the right fit.
Yeah. Well, we should definitely talk about that because finding the right trainer is, as you know, an adventure, and the right trainer can be amazing. Can definitely help you grow and whatnot. But it's not all puppies and daisies, right? Like there are some
butterflies
downsides.
and rainbows.
Yeah. So in a given week, on average, how many total appointments will your facility have between personal training appointments, chiro appointments, massage appointments? Just guesstimate it for us here.
On a week? It's got to be, I don't know, over like 500.
Not more.
Yeah.
If not
everything together.
Yeah. Something
right.
like that.
So you got a lot of footprints going through that front door, and you guys are seeing some stuff. Now, along the way, you guys were, if I remember correctly, you had just a clinic, you added a gym on, and you basically were operating as clinicians. Then, and you guys are pretty well versed in exercises, right? Like every one of your patients got exercise in some part of their care plan, right?
Yep, sure.
All right. So in the clinic gym model, I say there's 3 phases. There's the exercise phase where you got to just give exercise to every person. Then you move to the trainer phase where that trainer is doing sessions that are part of the treatment plan. And then finally you move to the membership phase. So you guys decide to hire a trainer, or one trainer or 2. I don't know how many it was. So when you get to that point, take us through kind of what you saw from a business perspective. You know, did your capacity increase? Do you remember that? Do you remember how much, did you notice a blip in your revenue? What could somebody look at and say like, hey, we see this trend line going up when you hired those first trainers? And just for clarity, I'm not saying people running classes in the gym. I'm saying the trainers that were working as kind of the relationship, I would say, is like an MD and a PA, a physician's assistant, right? They're kind of your CA or playing that role.
Yeah. And that's really where both of our initial trainers started, is they actually were our CAs in the clinic with us. So before we even really built the gym and had it rolling in the way that we do now, we had those trainers alongside us day in and day out in the clinic room as CAs. So they understood the basics of diagnosis, basics of pain management, basics of rehab exercise. And as we kind of had the individual conversations with those trainers, we started to find out that some of them wanted to pursue more of the fitness component to what we were going to hopefully offer. And so as they kind of matured as CAs, they then had opportunities to become trainers. And that's exactly where they transitioned and how we ended up essentially installing them as trainers from the get-go. And what it did for us from a revenue standpoint was, I mean, monumental. I mean, literally with a competent trainer, CA/trainer, we could treat and effectively bill double what we could pretty much do on our own. Because their extension, I mean, as a CA, they are an extension of our hands in that clinic. So they could be in the gym doing a lot of rehab. They could be, working with modalities. And that's always been something that's been super helpful in terms of business growth and development, is ensuring that they can play these roles that allow us to not only treat more effectively, but get more people in and just see more volume, which was important because we were limited with what we could do with our own hands at that point.
That's awesome. And just for everybody's clarity, when you hired these people, were they certified personal trainers through NSCA or ACSM, or were they just, as the old song says, just some geek off the street?
Yeah, that's a really good point, and kind of glad that you brought that up first and foremost. Is both of these individuals, before they were CAs and before they became certified trainers, none of them had any personal training experience at all. Zero.
Or any medical, any medical training at all.
All right. Well, what did you want? Like, what did you see in them that you wanted? Hey, let's move forward. Were they just good at customer service? Did they just have a caring heart? Like, what'd you see?
It was I'd say it was a combination of things. Energy in terms of, their ability to communicate with people, but also their passion. They really wanted to trend in that direction. One guy was like an all-state wrestler and really enjoyed coaching and was like, hey, I want to coach. And this is, I had a lot of people that impacted my life. I want to impact other kids' lives, especially high school athletes. That's kind of like what his little niche was. And so finding someone that's passionate, someone that had good energy, was a good communicator, good customer service, they both kind of fit that mold, I guess.
Nice. I had a business mentor tell me, we used to have lunch once a week, and just a great guy. And he would always have these little quips that he would tell me. And one of them was, if a college wrestler ever applies to your company, just hire him, because if nothing else, you'll never work that person so hard they complain. They just, collegiate wrestlers just don't have the complaint. They ran miles in trash bags uphill in a sauna. You ask him to sweep the office, it ain't going to break him.
Right.
So you made the right move there. Going back to that point, looking back, those first, are always our first employees are the longest ones to train, right? And then we realize, hey, we could have done what took us 6 months, we can do in 4 months. Next time we can do it in 2 months. How long do you think it took for them to get up to the point where you think they were, whatever you would say, fully able, fully certified, fully capable of playing that role that you wanted?
So we started a lot of that process while the build out was still going on.
It's called building the airplane while in flight. Like,
yes. Yeah. So a lot of it was us going through particular aspects that we've learned from our certifications that we wanted them to implement.
Yeah.
So we taught them FMS, FRA, went through and had them take CFSC and went through the whole CFSC process with them and did hands-on training for our progressions and regressions. For example, like with the onboarding process with doing FMS and FRA, and basically a pilot workout of going through, where their capabilities are for each specific movement pattern we want to do. What implements are you going to use? How do you progress, regress them? Where is their entry point? And the other beautiful thing about that is having a longer assessment process. You can figure out like, hey, is this person actually ready to jump straight into working with a group? Or do they need 3, 6, 12 sessions of personal individualized training one-on-one, because it takes them longer to be able to feel their body and understand what you're looking for. But yeah, it was probably 2 to 3 months of us spending a lot of like Wednesday afternoons, because our clinics only open for a half day on Wednesdays. So we would do a lot of the heavy lifting with them on Wednesday afternoons, probably about 2 months.
And that's 2 months after they knew all kinds of rehab stuff and had already been. So really, we're talking actually a year. I think one of them worked for us for a full year before he was really ready to actually start learning what Keith just talked about. And the other was about 6 months, I think. So it was a lot more than just, 8-10 weeks. We're talking a year of time and energy put into this.
But that is dramatically decreased with the more recent hires.
Absolutely.
Of course, it always is, right? You're like, oh man, we could have done that super fast. And then you look back also at the cost it took to spend Wednesday afternoons of hours of that. And you're like, hold on a second. We were paying one person to sit there and train, 2 other people to sit there and listen. Let's see if we can refine this. Yeah. I've been through it as well. And I mean, I would recommend everybody, like, there's no way I think you could get that under 3 months for them to get your mission, your vision, your ability. And now they can have the skills, the blatant skills of like, lift this weight, do it in this order. But 3 months is the minimum of you spending time with them. And I don't know if you guys see this, but I find that teaching somebody exercises is kind of the easiest checkoff box. The place where it's very difficult, and I think we overlook as chiropractors, is dealing with people who are in pain or were just in pain, and getting them to exercise is way different than going into a gym and running a aerobics class. Like that ain't the same, right? So can you talk a little bit about that? Did you get any lessons of teaching them about things like red flags or, painful transitions, and what recommendations do you have there?
Yeah, I think that that's where it was really beneficial for them up front before they were actually like training individual one-on-one clients, like membership, or small groups, membership-based training, is that they had that CA experience. So they were dealing with people in pain all the time, and they understood certain things to look for, like you talk about red flags, or just maybe, what a flexion intolerant lumbar spine is, and how to be able to rehab that and transition that into actual training versus just, constant bird dogs and different things all the time. So they had that exposure and that training for 6 months to a year before they actually were then kind of exclusively in the gym doing gym stuff and training. They had that exposure long before they actually started training people. So they had a ton of experience clinically with that.
All right. So a question for each of you, and you'll each have your own answer. So as I ask this, try and lock in your answer before you hear the first guy speak. Okay. But I'm just interested in this. One way, people always want this to be easy and simple and clean lines. And that's just not how patient care and exercise is, right? Like, what is the day you got strong? It's like, you can't pick that day on a calendar, right? It's a continuum. But let me ask you this. Once after that year, they are fully trained. If we just asked pain level for the 90% of the people walking in your door, and we use pain level as the marker, early on, I would guess that anybody over a 1 or 2, you'd probably be uncomfortable handing them to the trainer, right? Day one, like, if there's any pain whatsoever, it's like, I don't know, I'll hold back. But as we get more comfortable, what I found is I was much more willing to send a painful client to my trainer because my trainer had the skills to work through it, right? So after a year, what would be your line that, let's say you were just totally booked and you absolutely had no room in your schedule, what would be the highest pain level you'd be willing to send immediately to the trainer, where you don't get you don't evaluate, it's all up to the trainer at this point? What would be the pain level, just using a 0 to 10 scale? So 10 out of 10 pain would be, the worst pain they've ever had in their life. What would be the highest level patient reporting pain that you'd be willing to send to that trainer after they are fully certified, whatever you guys want to call it, fully trained, had a year experience and all that? We'll just lock in your answer and don't change your answer for in case you hear the other guy say anything.
I would say,
Who wants to go first?
I would say a 7.
Okay, you would send a patient with 7 out of 10 pain to the trainer.
Yeah.
Right. Now I'm going to guess not every patient. I'm not saying every patient with 7 out of 10, just if things get tight.
Yep. That's the max out. But yeah, kind of a green, yellow, red light for me. Anything above that, 8, 9, 10 is obviously bad, but it's very common for 7 out of 10 to be able to do some directional preference or whatever, reduce that quickly, and then start.
And your trainers knew that. They knew how to handle that.
Yep.
Awesome. Keith, what about you?
I was thinking a 5, but it also, as long as we already have a care plan set up and we know what's going on. The big thing is they know the exercises not to do, or the ones that would be the most likely to make them worse. And as long as that's really the biggest thing, is them feeling comfortable and confident that they're not going to make them worse.
All right.
Yeah. I'm right along with Nate. I'm like 6, 7-ish, but I can tell you exactly why is I wouldn't first off send a 6 or 7 with any random personal trainer out to the gym. I'm sending it out with people that we've hired that have been in the clinic, that understand what we're okay with. And honestly, we're not saying that they are becoming a 6 or 7 in the gym. They're going out there with pain. What's not to say that they're going to get better while training. So I think that as long as they don't increase pain levels dramatically by going through movements, which I know these trainers, and when they were with us, they were doing that daily, where they were checking in consistently with these clients. Hey, how you feeling? You have this kind of nagging thing going on. Is it the same? Is it better? Is it worse? Can you keep going? And I can also tell you that the communication to the clients was pretty thorough. So it was made known to them right up front that,
which is good for 1 or 2 levels of pain. I mean, if you clearly communicate to somebody that's an 8 out of 10 pain, they'll become 6 out of 10 in front of your eyes sometimes. It's people underestimate that sometimes.
Yeah. And so that's pretty much how I looked at the scenario of sending them out there, is I knew those trainers weren't going to train them into some super high pain levels. And if anything, they probably train them and they get better. And if they don't, then they're the same as they were when they went in there. And I was okay with that.
Yeah.
I think go ahead.
I was just saying, I had definitely have a patient who was probably 6, 7 out of 10, kept getting injured doing activities. And it's just like, look, we don't have enough touches and enough time to really work on the skills you need to do, how I like for you to build the capacity you need. So for them, I haven't seen them clinically in almost a year, but they were probably a 6, 7 out of 10 when they started training, and then they're not in any pain anymore and haven't been for months. But that just also depends on some of the cases. It makes more sense.
And again, this is like an ultra simplified version, right? Like for me, if somebody has an instability, like a true instability, so a pars fracture that has symptomatology around it, like even if they're at a 5, which would on your scale seem a little bit low, I would probably handle that, because instability is way more difficult than just like, hey, mechanical low back pain that's flared up. But I just want everybody that's listening to understand the reason we promote this idea of like the trainer being a CA. If you listen to like what you guys just said, 7, even if it's 5 out of 10, but 7 out of 10 is probably 80 to 90% of all the people walking in. So if we look at the medical setup, like an MD walking in, what percent of people would they send to a PA? And it's probably the same thing. About 80 to 90% could go to the PA. Now, who do you keep? Who does the MD keep? The ones that have multiple comorbidities, advanced age, they're being managed in some other way. And I think people should really look at that model instead of what we see in chiropractic, which is only the chiropractor can handle everything, right? And I just think like, of course you can, but do you really want to, right? Yep. So this leads to my next question. And I want to move off of like the glory days here after this question, because there's definitely some dips. If we looked at your schedule, like how many patients you guys could handle, before those trainers ever walked in a week, like how many patient visits could the clinic handle? And then you add those people in, these highly trained CAs. The reason I'm asking this question, let me just go back real quick. A lot of times people are like, oh yeah, I have a CA and they help out, but it doesn't actually increase their capacity. They're participating in the care, but they're not actually taking any care on their own shoulders and carrying it forward, which I think is a huge missed opportunity. I mean, basically I would say, like, if you guys got the flu tomorrow, what percentage of your patients could still get a visit, could still be billed, could still do that? It's pretty high, right? So if you look at the number of visits you could handle in a week before the trainers came on, and then after that year of them certified, what did we see for growth potential or capacity or whatever you want to say there? Do you remember any numbers like that?
Well, I mean, I think there's two things to say about that. To answer your direct question, it is, I mean, you probably go from seeing 50 people to 80 or more. And I'm not talking about a day, I'm talking about a week or for actually it's more like 3 or 4 days. But so yes, you're going to increase how many people you see, but I think it's also important to show the quality of that care also, in my opinion, also grows, right? They're able to execute a much higher level than if you're just doing that all by yourself. So you go from, if you did a 30-minute visit and maybe you spend 30 or 45 minutes with a patient, well, now you can do 15 minutes and the trainer or whoever can do 20 minutes. And now all of a sudden those people are getting, especially if you're booked out, you're able to get a lot more people in. They're still getting 30, 45 minutes a visit. They're still getting exercise with, for every patient. So not only are you adding a ton of revenue, you're seeing way more patients, and they're also getting really quality care versus seeing that high number of patients, but not getting the same quality of care because you don't have time to do all the exercise with them.
And if you think about
the other thing, go ahead, bud.
If you think about it through the lens of like developing the gym side of the business, it's also imperative that patients are exposed to the gym. And that gets really hard to do when you're treating patients by yourself. You're running from room to room.
Exposed to the gym long before we want them in the gym, right? Like,
they go out to our gym, they go out and they do their rehab out there. But that becomes really hard to do. If I'm in the clinic, I have 2 people in rooms, I'm jumping back and forth between rooms, trying to use my hands to do what I can get paid most to do, which is diagnose and work on people with my hands, and then trying to find time to take those people out to the gym myself. It just is, at best, it's inefficient and ineffective. At worst, you're just not providing that good of a service.
And the thing I was going to add in, I think Keith mentioned this before, that I think, so this is great. You guys actually beat the standard number. I always say that if you add in one of these people, it should expand your clinical capacity by at least 40%, right? You should, if you're seeing 100 patients in a week, getting to 140 with a highly trained trainer playing the CA role is not hard. You guys beat that. You're up around 50 to 60%. So it's even better. But the other side of the coin is we only, like you said, there's only 2 things we can do that nobody else in the clinic can do. Number 1, diagnose. Number 2, adjust, right? Even a lot of the muscle work can be done by a secondary, but we're pretty damn good at it. So you can kind of balance that out. So we should be doing those things. But the other side of the coin I would say is, if you look at a pyramid of all your patients, the bottom pyramid is the kind of mechanical low back pain, the, shoulder impingement, 3 out of 10, like the 80-20 of all the people, right? These are the boring stuff. I mean, it's what makes up the bulk of your practice, but it's not the stuff that really gets us out of bed and gets you to go to new seminars. But if we get to the peak of the pyramid, the challenging cases, the ones where, you're the 4th person to see them and, they have a lot of stuff. What that capacity also allows you to do is when you see that case pop up in front of you that is a true, zebra, it's so refreshing to be able to go like, Mrs. Johnson, this last patient's taking a little bit of time. I'm going to have you start out with, our trainer, Mark, or whatever your trainer's name is. I just need a few more minutes. And know that handoff is not a hand down. It's not a dumping on Mark. It's actually the person's going to start out really well and we'll probably have some good tissue tone changes and things like that. And then you can grab them at the last minute. But you can get really famous in your area if you take on a few really complicated cases that have seen a lot of people in your area, especially if they're the kind of complicated case that keeps going back to their primary care and telling them how, oh, that PT couldn't fix me. That chiro just, cracked me and nothing happened. And then you're the first person to go, I'm going to commit some serious brain power here because I'm not distracted by my 2 out of 10 tail end of a sore hip with some FAI. Like, okay.
It's actually funny that you say that because just before you said that, I was literally thinking about Tuesday before we came. We're up at an MDT Part D course in Portland this weekend, and the day before, obviously being out the rest of the week, Monday and Tuesday were pretty packed and stacked days. And it's a perfect example of what you're saying when those, and go figure, it always works this way, right? Whenever you're the busiest, the schedule's completely packed, what happens? Who walks through the door? The person who you are absolutely.
It's a freaking magnet. It is a magnet when your schedule's like.
That's right, man. So what comes in is, Ms. Jones comes in, who's normally fine, and she can barely walk in the front door, and it's like, where am I going to find time to feel good about leaving this encounter, knowing I did something good for this person? What you said is exactly what I do with my CA is I'm like, hey, and he knows me well enough to know this. He's like, we got a doozy in there. And I'm like, yep. I'm like, so I'm going to be in there for 30 minutes, man. So I need you to go in the gym and I need you to review this stuff and perform these therapies or whatever. And if we don't skip a beat, we've done it now for a while, but you're right. There's clinical freedom. And I think at the end of it, and what drives almost all of us to do that kind of stuff is we want to be the best at what we do, flat out. And you can't be the best at what you do if you're running around like a chicken with your head cut off, not able to address people's actual problems because you're trying to fit a day that for all intents and purposes is overbooked. Right. And so, yeah.
Or the fourth person in a row who has similar findings is a bad way to help you see what the fifth person has.
Right.
If you're like, oh yeah, everybody has this or everybody needs, blah, blah, blah. It's like everybody has a bad SLR. And then the fifth person has a clean SLR, but yet still is complaining about, radiating pain down their leg. And you're like, oh, that's unusual.
Yeah.
Huh.
Or something.
You got to kind of stop and take a breath and be like, oh, what do I need to do now? And it's like, well, you need to clear out the next 15 minutes of your schedule and maybe some more after that. So,
there you go.
All right. Well, for the sake of time, I want to move on. So you guys are doing well. You're kicking ass. You move these people. And just to kind of condense the story here, you got these two great trainers, right? They end up, like you said, they wanted to coach more in the gym, right? They certainly have the skill set to take a patient at 7 out of 10 or below. And they also have the ability to take somebody who's coming in the gym essentially with no pain, but is just like, hey, I heard you guys are the place to be. They come in. They start doing that aspect. Your gym starts growing with what would we call that? Gym-based clients, the ones that haven't necessarily come out of the clinic, right? Getting a ton of people from the clinic into the gym, which is the number one growth strategy of a clinic gym hybrid. But then you get some just clean gym members. And by the way, just a clarification point. I always say that within a year, 100% of your gym people will end up at some point going back to the clinic, even if it's for 1 or 2 visits. Would you say that's pretty consistent?
Yeah, I'm pretty sure that every single client, if you will, that's in the gym has come in for clinical care at some point.
Yeah. Now, I'm not saying like a full 26 visit treatment plan, right? Sometimes it's like a little tune up here and there, but they do engage you.
Yep. Absolutely.
Yeah. Okay. Perfect. It's just reassuring, because Grants Pass is such a weird area with weird people that even there, the numbers that I talk about hold up.
Hey, watch.
Talking about you to your face.
Yeah. All right. So everything's going smooth. You train the hell out of these people, and you guys make a decision business-wise that, hey, we're gonna make you part of the team. You're gonna wear our jersey, and talk about that real quick. So what I mean by that is, you could have a 1099 contractor and save yourself some money on the front end. You could have a W-2 employee. It's more expensive, but there's some advantages there. Which way do you guys decide to go?
So we ultimately decided that they had to be employees. And that was for a couple of reasons. But the biggest is that it makes sure that you still hold the reins, if you will. As a contractor, they can pretty much come and go, as they please. Whether you have an agreement of some sort with them or not, they kind of can do what they want. They can kind of still train how they want. They can decide when they want to come into work or not. Legally, you can't do a whole lot other than have like a handshake and say, hey, do what we want you to do. And they'll say, okay. But when push comes to shove, there's nothing binding them to that. So we decided let's still have that power, and let's do W-2 employees. So we did. And that was very beneficial just because we were able to actually have much more systematic approach to things. And then we knew exactly what was being done and how it was being done. And we had better control in terms of what was going on in our gym. We didn't want, just any trainer that was a 1099 employee, a contractor, just coming in and running a class and leaving. There was a lot more buy-in from the trainer, and there was a lot higher end product that was put out by us employing them.
Yeah, and I think that to go a little deeper there, I guess that the simple way I look at it is this: when you hire a 1099 contractor, you're basically paying them to do a job, but you don't get that much say into how they do it. So for trainers, they're coming in, we're paying you to train. How they do it is kind of up to their discretion, right? It's like if you pay a contractor to come in and build something at your house. I mean, how are they going to do it? Well, that's up to the contractor, right? So I think that is a simple way of looking at kind of how it could become a hazard if you're running a very systematic business and you have a very specific approach and you're trying to produce a very reproducible product.
Right.
If you don't do that, you can lose control real quick and things spiral. But even more so, you lose the team aspect and the community aspect, because it's almost like now you're having a stranger come into your business who isn't really a part of your team. There isn't that community. I mean, we look at fitness businesses like CrossFit boxes, right? Why are they so popular? Why is there such a support for that community? It's because of the community. People feel like they're part of the team. They don't feel like everyone's there doing their own thing. Does that make sense?
Mm-hmm. Yeah. No, and you guys are talking about the benefits of it, and part of the point of this podcast was to talk about the dark side. I hope the reason everybody resists making everybody W-2 employees, especially in a gym, is it's expensive. My accountant tells me it's at least 20% more with just the addition of paying a little bit more, payroll tax and all the different things you have to kind of ensure to get the ability to tell them exactly how you want it done. Mm-hmm. And I would agree 100% with you guys, where I would say employees are a better setup long-term, but your accountant is going to argue with you about like, oh no, then it's so expensive. It's like, right, but I need this person to fly our flag. I need them to wear our jersey and play for our team, not whatever team they want to go to. So that leads to this next thing. So there you are. You guys have spent the money. You've trained the hell out of them. You spent hours and days and weeks and months training them, right? I'm sure you've sacrificed a lot of stuff, bought a lot of coffees, given a lot of high fives. Everything's going smooth. And then what happens?
Well, this is somewhat of a long story, but one of our trainers, who was basically kind of, if you want to say she was the lead trainer, that's pretty much what she was. She was probably one of the best in terms of her ability to actually think critically and not just do what we told them to do, but actually be able to think for herself and execute things fairly well. She worked for us for a year and a half, trained, actually it was almost 2 years, and she trained in the gym for almost a year and a half. And in July, we started kind of noticing a few changes personality-wise. She wasn't as energetic. She seemed a little bit more distant and wasn't quite the the same person as normal. She'd also kind of stir the pot a little bit. She would go to one owner. So she would go to Nick and say something about me, and then go to someone else and say something else about them, and all these things that were just not ideal. And to put it lightly, she ended up asking if she got her vacation paid out or if she had to use it, which we said, I want to encourage you to take your vacation, get away from this place for a little bit. We don't want to just pay you out. So she took a vacation.
Again, a benefit of being a W-2 employee, right?
Right. Yep. And then as soon as she comes back, she basically says, okay, I'm going to put in my 2 weeks. And, with how we train people up, you can't just hire someone and be like, yeah, okay, get in there. So we had a conversation with her and we're like, hey, look, like we do have someone else actually we can hire, but we have to train her. Like, would you please do us a favor over the course of the next month, or I think it was next 6 weeks or so, and just help us train her? Like, it would be a lot mean a lot to us, because we feel like we've invested quite heavily in you, and don't do us like that, basically. So she says, okay. Well, that entire time that she was helping train, she was setting up her own personal training business. And she created all her content, her website, her Instagram, her Facebook, all of that stuff used on our dime. So she was literally doing some of that on our computers at work when we weren't watching. And then I think it was about, I don't know, 4 or 5 days before she was actually going to be gone, like her last day. And I started seeing her post while she was still working for us, all the stuff that she's leaving. She's telling clients. I'm now starting to see that clients are not re-upping their memberships. And it's a very specific type of client. She was starting to take all the female clients because she wanted to do her own female gym and just exclusively train female clients. So she starts posting all of this stuff about her leaving. And then what ended up happening is I got on the link because she wasn't hiding it, got on the link, looked at her website. She literally took every single thing that we had done and taught her and duplicated it. The entire assessment process, the same wording. And then she put a legal disclaimer on there that it was all of her own
time,
intellectual property, I think was the term. And if anyone said that or tried to say that it wasn't her or whatever, it's basically a copyright type thing, even though it wasn't copyrighted. But she basically took our entire system and she literally went half of a mile down the road and opened up her own gym. And then on her website had testimonials from women that were that had
never worked out in that facility, had worked out in your facility. So any testimonial,
they were like training that morning, literally in our gym with her. And she had 3 testimonials from our own clients. And it was, it was very eye-opening. And we knew she was going to go be a trainer somewhere. We knew that. We didn't even care about that, but it was just the blatant taking of everything that we had done and then promoting it within our business. And how she went about everything. I mean, literally, she didn't, if she just waited, 2 weeks after she left and did it, then that's one thing. But she did it while she was still working for us and set it up on our dime.
Which, you mind if I share a story eerily similar to yours?
Yeah.
So I had my facility. We hire this young kid. He's a massage therapist and a trainer. And you can see he's got, like you're saying, like critical thinking skills, all those things, right? Good personality, etc. I remember the conversation when I said, hey, I want you to come over more, like, I want to start teaching you all these methods. And I remember the conversation. Well, I promised the gym he's working for is like a big box gym. I promised them that I would complete this Poseidon's Fury water aerobics class. That was the thing in our way from getting him over to our system, was he had to continue teaching Poseidon's Fury, right? So just to get it into like perception. So we're going from water aerobics for 72-year-old women to a performance-based model of assessment and problem solving, right? So he's arguing with me why he can't come over. Cool. So luckily, water aerobics class contract ends, comes over. I proceed to basically, like, what assessment do you have? Nothing. How do you find what to do? I don't. Like, what? So I'm like, okay, so let's start from the beginning. So I basically, like you guys, taught him, because he was a massage therapist, so he could handle some tissue work. So he learned the SFMA. I taught him the FMS. I taught him the Y balance. I taught him the TPI level 1 screen. I taught him the CFSC, FRC, all the things that I thought were good. We either brought him into the gym or I taught him specifically, right? And then thinking I was investing in this person, thinking that it was going to benefit, I don't want to say benefit me, mutually beneficial. I want to have the highest paid person, the highest trained person ever, right? So I take him with me when I would teach SFMA courses, right? We went down to Southern California. He went there. He met some of the, developers of the SFMA. I take him to this big golf conference and introduce him to people there, right? Like I was like, hey, I'm going to introduce you to everybody I can because I'm investing in you, right? Along the way, we had a couple professional golfers. We had an NBA player, all these people, and he was working with them. And then mysteriously, those people start kind of coming off the schedule. And I'm like, oh, that's weird. And then I find out that he was using our computers to use our Perform Better discount to go buy the gym equipment to build his own training thing. All these people that he was working with, just start disappearing off our books and going there. And then within a year and a half, he ends up on this like top 50 trainers for golf list. And I'm like, hey, that's awesome. Because in my petty mind, I'm going, oh, that's awesome. So they have an award for people who taught Poseidon's Fury. That's incredible. It's amazing. Now I struggle with this because like I said, that's being petty. He had the initiative, he learned, he integrated, he taught it, right? But it's still like, dude, some sort of verbal thank you and a thank you in action of, hey, thanks a lot. This opportunity is whatever. I'm like, that'd be nice to hear. That'd be nice to know. That'd be nice to, I would love to appreciate that. And also, then he went on a podcast and talked about his method of developing things. And I'm like, God dang, I've heard that somewhere. Where did I hear that? Oh yeah, I built that process. Yep. That's exactly, and I trained you in that process. And I trained people you work with in that process. And I developed it and I saw how it worked. And then I marketed that locally. That's where I've seen that process.
Yep.
And it's just like, God dang it, what do you do? So it's incredibly disappointing in that regard. But again, that mentor that I had said, all right, what's the other option? Would you have rather you never taught him anything? I'm like, well, no, I would not want that person flying our flag, wearing our colors, who didn't know anything. Right. The fact that he was good enough is part of I don't know what you want to say. It's part of it. But I'm telling you this because, I haven't shared that story, but it was just so eerily similar to yours. I'm like, this happens a lot, this happens a lot. And what do you do? I can tell you what I would be thinking. I would be like, okay, hey, Keith, Nick, when do you guys want to go firebomb our place? I don't, obviously we'll wait till everybody leaves, but I bought some bottles to make some Mama Hope cocktails. You think Wednesday night, Thursday night, when's good for you guys?
Yeah. Well, I can say that one of the hardest pills to swallow is kind of obviously it's the feeling of betrayal more than anything else.
Yeah, but absolutely.
But the main
it's like a slap in your face. Like you did all this work, you invest in that person. Oh. And I look back, I'm like, and I don't know if you guys have this feeling, like, what did you bring us? Like this was set up as a synergistic relationship. 100%. I dumped into you 1,000, everything I could do. You couldn't find anything I could do for you. And the return would have been years 2 through 5. That's right. Where I would have got a return.
Yes. Yeah. Exactly.
We made it to 19 months or whatever,
Right. And that's what I was just about to say is like the thing that's the hardest pill to swallow for me is first and foremost, when she came on in the business, absolutely zero fitness or training background. Zero. None.
Dude, she applied for a front desk job at our satellite clinic.
Yeah.
And then we were like, you have.
And so she was, through the process with us, became NASM certified became precision nutrition certified, became CFSC certified. I literally would spend
becomes literally the top 1% of her profession.
Yes.
Yes.
Yeah. And imagine that in a small town like Grants Pass.
In a year.
Yeah. In a year.
6 months.
Yeah.
Yes.
So to go through that whole thing, I mean, and this would have softened the blow, wouldn't have made it completely benign, but to at least give credit and recognition for where that stuff came from for her would have meant a lot to me. And I heard a quote, I forget exactly who said it, but they said something like, there is absolutely nothing wrong with giving credit where credit is due. And for some reason, and especially it's weird, like in the fitness industry, there's so much dang ego, man. It's people don't want to talk about we have absolutely when we've made this very clear, because you go on our website right now, it will literally say this. We name the systems we use. We give the credit to the people that taught us. We don't say we invented FRA. We don't say we invented the FMS. We don't say we invented the CFSC. We actually say we run these systems because they're the best that we can find. We're just going to do our best to be really good at them.
You know, a good version of that is like when you go to a high-end restaurant and they're like, we only use, Smith Farms Black Angus beef because we find it's the best. Like, yeah, you can order the beef from here and the carrots from there and the celery from there, the best ingredients, but somebody's still got to put all that stuff together. Right. And taking FRC and CFSC and the SFMA and all that, that's great. And thousands, tens of thousands, hundreds of thousands of people have taken those. But putting it all together is the challenge. Putting it all together that's where you shine. But it's just good business practice, if nothing else. Even if you don't feel it in your heart, like giving credit to those, and the people along the way. And yeah, like what would have been the downside on her website to say like, hey, I had the pleasure or I was lucky enough to mentor or to get trained by the chiropractors over at, what is it? Total Chiro Performance, Total Performance. Yeah. Like, two sentences on your website, like what that would have said, or, even brag about it. Like I saw I was clinically trained in a place that saw people with pain every day. Like, not only would that reassure your clients, lady, like you should say thank you, So yes, there are crappy people out there. You and I have both experienced it and it sucks. And I'm sorry you guys went through that. I know how much it stung me, and it makes you think like I'm never going to do that again. But you still have a business and you still have a capacity that you got to fill, right? And you still know what it could do. So
we were able to, I would say it when she left, between just the upheaval that it created and the chaos, and then her taking some of the clients, we probably lost, I don't know, between 35 and 40% of our clients after that. And we had to get new trainers and build them up. And now we're up and going and cooking again. But I mean, we're talking, it's been almost 6 months. So it took us a good 5 months to kind of recover from that and get back on the right trajectory.
How much did it affect your overall revenue? I mean, you guys got massage therapists, you got 17 different things, but.
Well, I mean, from the gym, let me put it this way. I think we, at the peak when things were going well, we were almost at doing about $15,000 a month, and we had been open for 1 year, and we went from that to like maybe 7,500. It was like half.
At least cut it in half.
Yeah, and then now it's kind of coming back, but it was a blow. It was a momentum killer, big time.
Well, and it obviously also limited us a ton with just putting new people in the gym. You're down a trainer.
Oh yeah.
We don't have the capacity to actually fill schedule. I mean, the other trainer that was there was overloaded. He was super full and he was having to train new trainers, and it made for a very uncomfortable situation for us business wise. Yeah. But all of that being said, I mean, as Nate already mentioned, since that time we learned a couple things. And one of the first things is how to deal with these individual scenarios and basically protect ourselves going forward. But in addition to that, we really got good at taking a step back for a minute and looking at our systems in the gym. And instead of, I mean, you obviously hear how much it didn't feel good for that to happen to us. But one thing we all did was kind of sat back one night, had a couple beers around the fire and said, like, what could we have done to make this something that we could have hurdled over easier? And what it did is it allowed us to just expand the hell out of our systems and make them super effective, and make sure there was no communication breakdowns in any way that we could, and make sure that the trainers that are in the gym by themselves often feel communicated with and connected to the team, and really kind of just trying to find ways to maximize, that part of the business, instead of just kind of solely focusing on gaining members and seeing revenue come in. And, so that's been good. I can say that that's been something that I think.
You guys are lucky. Let me tell you my version of it. I didn't have business partners at the time, and, I didn't have anybody. So I was laying in my bed, sweating, staring at the ceiling, not sleeping, thinking, man, what did I do wrong? Where could I have gone? And like wondering what was happening around me, like, am I just a total a-hole? Like, because you're so angry and like so disappointed at the same time and hurt. So that's good. I mean, those are the things that will build your business to be bigger and stronger in the future. And it's pretty rare to find anybody that crests, let's just use $1 million in revenue or 5 million in certain things, where they don't have a time where it almost got shut down or it almost broke in half, That's just how it goes. And it's the same with, you ever hear about powerlifters and people in the gym, like it's most common that somebody got injured before their world record attempt, and their comeback, their rehab led. I had to really work on my technique. I had to really improve my setup. I had to do, that's when I first got exposed to intra-abdominal pressure and things. And it's like, it doesn't just happen in business. So we got about 5 minutes left here, but just looking forward, I don't want everybody to leave this podcast going, well, that's it. I didn't want to hire somebody early, and I ain't going to hire him now after hearing those two stories. But in all seriousness, like, you guys saw what it was like with these people, and you would never go back to a different business model, right? Of a clinician-only business model, right. I'm going to guess. So as you move forward, can you each maybe give one tip or advice that, I'll tell you, I'll start off with mine, but one tip or advice, or if you guys want to give us just 3, moving forward, building up that team that you're like, I'll never do it this way. I'm never going to go back because I realized what a problem that was. So ours is we do meetings every 90 days now. And we do this, what's called a VTO, Vision Traction Organizer. It's out of the traction book, EOS. It turns out I didn't make this up. I actually learned it from somebody. So let me give them credit.
We literally just started reading that book. I'm not kidding. A week ago.
As a group of business owners, that's what we're doing.
Yeah.
Good. And I think it's awesome. And so we do the VTO. Hold on. I have it somewhere here. It's on. I cleared off some things on my desk here, but sitting over next to my desk. We talk about what are we going to accomplish that, in the next 10 years, 3 years, 1 year, and 90 days. And then every 90 days we meet and say, like, what can we accomplish? And since we have done that, we have hit a freaking home run every quarter, knock on wood, right? But what I realized before is I just said, hey, we should all grow. And that sometimes got translated to, hey, you should grow your own thing, not worry about what the team's doing. And I'll never go back to doing it the other way. Yeah.
Definitely.
Well, how about you guys?
I can piggyback a little bit on that. And I will say this, so this isn't going to be the exact same thing as you said, but it's something, again, that has changed a lot for us, especially over the last 3 to 6 months ish, is how important the development of systems are as you get bigger as a business. And we've had conversations recently about expanding the business. What does it look like with multiple clinics down the road? What does it look like and we're talking clinic gyms, right? So
yeah,
one thing we've kind of come to the realization of,
I can get behind that idea. Don't worry about
it. One thing we came to the realization of is, it's just us 3 and our other business partner, Scott Thorson, who's down in GP right now. But man, if we want to own more clinics and gyms that are tied together, we have to have systems that ensure that, number one, our product gets delivered in the way that we want it to, but we have to have systems that basically run themselves when we're not there, because we can't be everywhere all the time. And it's systems that not only involve the runnings of the business, but also what you just talked to, which is what you're really referring to is sitting down and having good communication. That's really what it is. It's like making sure that things are being communicated well across the entire business. And that goes from the smallest part-time piece you have to these, maybe bigger pillars, business owners, so on and so forth. But if you don't have systems that help you along the way, your business really becomes unscalable, and it's hard to grow without failing until you realize that's needed, and then you change it, and I think you can continue on. But yeah,
you want to turn into McDonald's where it's so systematized. Somebody leaves, like I'm gonna go out, and then it's like, oh, you think you can make hamburgers like we did? Like your hamburgers aren't as good as the ones I'll make. It's like, right, but go like if you think the hamburgers are the challenge here, buddy, like you are so. That is such an infinitesimal part of what this business is all about. So that's awesome. Sorry, what about you, Nate or Keith?
I would say that I guess for me, first of all, what Nick said, it kind of encompasses like everything. Like everything's kind of under a subcategory of that. But one thing that I
hear that, Nick, you have all the answers. Your brother finally said it out loud, like it's recorded. You are the smart one. You've all the answers. Period. We can end it right there.
One thing that I think I took from this, and I think that Nick and Keith would probably say the same thing, is having at least in our structure, because we do have multiple owners and docs, having a designated person to handle gym stuff, like the gym side of the business, because sometimes you can have too many cooks in the kitchen. And when you do have that, sometimes the management is not, even if you all share the same vision, you might answer things slightly different. And that kind of burned us. We had, similar messaging, but it was similar. It wasn't the exact same. And so once we kind of realized, hey, we need one person to go ahead and manage the trainers and kind of meet just with them versus us having a group meeting and then they don't know who to go to. Should I go to Nate for this? Should I go to Nick for that? Should I go to Scott for this? Having one person that really kind of ran that side and headed it up, once again, going to the next thing of systems, like that was really important for us to be able to communicate well and then grow appropriately.
Yeah, I love it. One thing I can't remember what business book, I think it's Scaling Up by Vern Harnish, which is a great book once you guys are done with traction, but it's really for that middle ground of once you have a system and you're making some good revenue, what do you do next? But he says, in the end, for every part of your business, there should be one name who is accountable for it. So you have to account for every dollar spent, every action taken, every message sent out. And it has to be one person. As soon as you have two in there, you have a problem. You just don't realize it yet. Yep. So even it's like, hey, who's in charge of ordering Windex for for the office?
Yeah.
And it's like, oh, I'll go pick it up. I'm going to Costco anyways, or I'll go. And then you end up with 64 half empty bottles of Windex. He's like, one name does inventory for the Windex, right? Mm-hmm. And I think that goes along exactly what you're talking about. Whereas early on, you're like, if everybody can contribute, we'll get so much farther. And it's like, yeah, but you don't realize that that's creating a lot of confusion in the future. Yep. Keith, what do you got?
So along the lines of more specificity on some of the systems, one of the biggest things, particularly with onboarding and decreasing that time frame to get someone prepared, is reference material. So that's where we have our trainers go through their CFSC, or they'll come and ask me questions about an aspect of programming, and I'm like, hey, look, I know that answer is in Mike Boyle's lecture, in this specific lecture or that specific lecture. So I want you to go watch that, and then we can come back and have that quick conversation. And it's always gearing back to something that is unchanging in that standpoint. So okay, if you have questions on how to regress this, well, go to these videos, check out those. You have this reference material, oh, hey, here are our baselines for you right now. Your primary thing you need to be able to do is you need to be able to do baselines. You need to be really good at teaching and coaching the regressions. Then we can get you better at all the other things. But having that piece of it, because we don't have time to do 3-4 hours of training once a week.
Yeah.
Like it's just once things get so busy on the clinic side and all the other tasks we have to do, you don't have the time to do all the education. So having those references and saying, hey, go learn this, and then we'll fine tune it together. But I need you to go get that base material. The other thing is, like, a lot of times you need more than one touch to learn something. I have mentors who I've heard give the same lecture 15 times, and every single time I learn something new. So being able to have that kind of reference material and just say, hey, go back, you need to retouch this, then we'll fine tune. It's really helpful on decreasing that time frame. So it's not, 12 months to get them prepped. You can get it done in 3.
Can I give you guys a suggestion around there? I'm going to share this at our live event in Dallas, which everybody should sign up for, by the way. Go to clinicgymhybrid.com and look for the live event in Dallas, May 21st, 22nd. I found a kind of a good recipe for teaching, which is put together a 12-week program, which is about 90 days or a quarter of the year, right? And if you need something to put the 10 buckets of exercise, week 1, week 2, week 3, week 2, all the way through 10, then 1 week of red flags, and then 1 week of customer service, right? And then just set up a simple Google Doc or a spreadsheet or a video and say, hey, here's what we're covering this week. Your responsibility is to study and understand these before our training meeting, so before your Wednesday thing, and then film yourself doing these and send it to me before Wednesday, right? So they have to go through it, and the proof is that they send you the video, right? Now it can be a super built out system of when they submit to a site and it pings you or whatever, or you can just do it through text message early on. But getting them to send a video in shows you, and then you can also watch and go, oh my God, like either my instructions are bad or this person's an idiot. But one of those two things is true right now. But submitting that video, and same thing with customer service or answering the phone, right? Just set up a video of you answering the phone or faking the call works pretty good. So having them send that back to you, but it also gives a checkpoint of, are you done with your homework? Because telling people, oh, go review this, it's like, well, that's kind of, yeah, I reviewed it. It's like, yeah.
That's where the follow-up is super important to make sure that they're actually understanding the material. And
I think that's a great point. Doing that, their video is due before you guys do your group training, because then they've been through it once, and then you can talk about like, hey, in your video, Keith, I noticed that actually your foot placement was not correct. Remember, it's 4 steps forward, and then, or whatever it is. And it allows you to go back and do that. And it lets everybody know, like, hey, we don't F around here. Like, you're responsible for knowing it before the training, not you're going to come to the training and know it after. Like, no, you got to know 75 to 80% of it before you walk in the doors. So anybody listening, I hope that helps. But anyways, fellas, listen, I really appreciate your time, and I appreciate the fact that you guys, your chins look kind of tough there from taking a couple blows on them. So congratulations. I truly do hope that this drives you guys forward and you produce some better systems and better methods of operating, because the worst part about that story that you told me, and I think the worst part of mine, is you did all the right things, right? It wasn't that you were trying to screw everybody. It wasn't that you misled them. It wasn't that. It's like you did almost too many right things. But I don't want to live in a world where it's like, oh, we're going to pay a little bit less, or we're not going to teach them the secret sauce because they might go somewhere else. Like, we have to just accept the fact that they may go somewhere else. But you know what? If we can build such a great culture, they'll never want to leave us, And I think in the end, that's the true solution. That I personally struggle to get there. I personally struggle with my team to make it so invaluable that they want to stay no matter what, So with that, you guys got to get back to MDT Part D. Well, I got bad news. I talked to the instructor. He said it's actually MDTA, but you guys scored a D. But yeah, well, I've been waiting to launch that joke the entire interview. All right, so. But in all seriousness, if somebody wants to reach out or come see your place in Grants Pass or something, are you guys cool with that? And
they should do it.
How can they find you?
They come to the SFM. They come to the SFMA event on June 11th and 12th and see it firsthand.
Yeah.
But if for some reason they couldn't make that, they could probably go to our website, www.totalperformance.clinic, or email us at admin@totalperformance.clinic.
But
Awesome.
also on that note, in all reality, there'll definitely be some post-seminar clinic gym hybrid conversations. So if anybody listening to this podcast has, a goal or has aspirations to have that, not only are you welcome to see what we've built and how it's running, but also being able to have conversations, I think it's a two-way street. It can be super valuable for us too. So come on now and let's do it.
I love it. Yeah, I think you guys are showing the physical plant is a good example of it. And then the clinical model is just about perfect and those two have to work together, and you guys are perfect representation of that. And then the clinical, whatever you want to say, ladder. So you have massage therapy, you have training, you have chiropractic, you have all those things. So you guys are probably one of the best representations of the clinic gym model in the world. So nice job, boys.
Thank you, sir. Thank you, man.
Yeah. All right. Well, on behalf of Nick, Nate, and Keith, this is Dr. Josh Satterlee saying, go out there, maximize your license, and live the life you dream of. Thanks a lot, fellas.
Thanks so much for checking out these videos. I hope they're useful. We'll cover things like rehab, exercise, business model, progressions, layout, everything else that helps you build a clinic. So if you're interested, you can click here, there, here, or anywhere to get more videos just like this. Thanks a lot for watching, and we'll see you soon.